This is a special edition of the MeidasTouch podcast. I'm Ben Meiselas from the MeidasTouch Network. In just a few moments, California Governor Gavin Newsom will be addressing the state of California as well as the entire nation regarding the disastrous budget bill and the horrific impacts it's going to have on most Americans. I refer to the disastrous budget bill as a murder bill because it quite literally will kill millions of Americans, in my opinion. It will take 15 million Americans off of their health care, off of their Medicaid, off of their Affordable Care Act plans. Also, it is the single largest redistribution of wealth from low-income and working-class Americans to the billionaire class. Billionaires will enjoy trillions of dollars in tax cuts, while working class and low-income Americans will be screwed. Essential services will be taken away and stripped from most Americans, whether it's housing and rental assistance, whether it's supplemental nutrition assistance program assistance. And the disastrous budget bill is also an attack on women's reproductive rights. It is absolutely horrific. But without further ado, I want to call in California Governor Gavin Newsom to address the impacts the disastrous budget bill is going to have on the state of California and, frankly, the entire country. We're going to not just see this in California, but in all of the states. So let's bring in California Governor Gavin Newsom.
That's good. So just wanted to thank everybody for taking a little bit of time on an extraordinarily busy Friday with so much going on, so much that is being advanced, not just in Washington, D.C., but all across the globe. But I really wanted to circle back on such a foundational and profound and consequential decision that's about to be made by the United States Senate and advanced back to the House of Representatives as early as next week. And I wanted to underscore how consequential, how profoundly meaningful this big, beautiful betrayal, this bill that President Donald Trump is advancing in Congress. We wanted to paint a picture of the betrayal and put a perspective here in the state of California and how consequential it is. I will set out the numerics. I'll give you a sense of the estimated impacts on the state specifically, but I'm pleased and blessed to be joined by Director Boss and by Secretary Johnson, who will start to paint a human face and put a human face on the impacts of these devastating healthcare cuts that likely will be landing on the president's desk very, very shortly. Let's just quickly go over some of the top lines on the bill. You see a lot of different estimates out there, and we've all been struggling, I think, with trying to understand the magnitude of what the experts, quote unquote, are estimating to be the actual cuts to Medicaid coverage all across the United States. You can just see three just random examples. The Congressional Budget Office. This is, again, specific national impacts to Medicaid coverage loss alone. This is not the totality of the bill in terms of healthcare coverage reductions, but it gives you a sense of the Medicaid specifically. You see the Urban Institute has a different number and a substantially higher number by the Center on Budget and Policy Priorities, some 14.4 million Americans. So we've been analyzing all of that. We've been reviewing the details of the House-passed bill, the amendments, the bird bath, as it's referred to, as it relates to what's in, what's out on the Senate bill. This is a snapshot of what we know today and what we anticipate will be happening tomorrow and over the weekend. Up to 3.4 million Californians are at risk of losing health coverage specific to the Medicaid and under our Medi-Cal system specific to the bill. Some $28.4 billion of federal funding is at risk that's associated with those losses. So 3.4 million. And I remind folks in California, we have about 15 million people on Medi-Cal. It's a substantial number that are at risk of losing health coverage. Here's the breakdown. About 3 million people, we estimate, will be directly impacted by the work requirement and the paperwork. And I should note the paperwork, that's an actual PDF example of the paperwork that people will have to submit to for their eligibility checks, and that impact every 6 months. We think will reduce the number of people getting health coverage by 400,000. The paperwork you see there is 36 pages long. Just gives you an example, or at least a perspective, I hope, on the magnitude of what that paperwork means. There's a hassle factor, and that's exactly what they're counting on to score the savings, to score the cuts in terms of these new requirements. So the work requirement, we estimate that about 5.1 million people would be subject to these new rules, of which a third likely will have met. And this is based upon our assessment and analysis, based on our data runs, that about a third of 5.1 million people, 5.1 million of the 15 million, that will be subject to the new requirements under the big, beautiful betrayal. And a third of them will likely, and this is an estimate, meet that work requirement, which is 80 hours, income, and wage levels. The other 2/3 will go through the labyrinth of manual verification, et cetera. We did some very comprehensive analysis based upon some real world examples. I'll give you 2 specific examples in Arkansas and New Hampshire as it relates to the self-verification and the manual process. And we came up with numerics based upon the number of people that dropped out of their program when they instituted those verification procedures. And we blended that and came up with a percentage that ultimately led to the number you see on the screen. And forgive me for confusing you, but we've really dived deep and really tried to stress test our estimates. And we feel very confident that up to 3.4 million people will lose their coverage if this bill passes under the Medicaid system, just in the state of California alone. But that is not it. I want to remind you of the monthly premium increases. Millions of people will also face under Covered California. I'll also remind you, Covered California is not a general fund backed program. It's not a state program in that respect. Covered California, however, will see premium increases for roughly 2 million recipients. And we estimate on that basis that as many as 600,000 additional people will drop that coverage. So 3.4 million on the Medicaid side under our Medi-Cal system, an additional 600,000, 4 million people likely to lose health coverage, increasing uncompensated care, moving from one of the nation leading low uninsured rates. We're about 6.4% currently, one of the nation's leaders in terms of healthcare coverage and support. And to see those numbers increase by as much as 4 million people. Now, we can talk a little bit about what that means, but no part of our state, and for that matter, across the United States, or other parts of our country, will be more impacted than the impact of this betrayal on rural communities. And I don't think it's an exaggeration to say devastating rural communities. And let me back that up by providing you just some enrollment data. You can see here the Medi-Cal enrollment by county. This is a percentage of total population. Upwards of 64% of some jurisdictions, some counties in the state of California, 64% of all of the residents in those counties are on Medi-Cal, on national Medicaid. Just to put it in perspective, who this really hurts. I'll remind some of you that may recall, it wasn't that long ago, just a few years back, in an effort to address the crisis for rural hospitals, we initiated a program in partnership with the legislature that funded, this was a state loan program that funded, because the crisis already in providing care in rural hospitals provided to 16 hospitals in these 14 counties, $300 million in state loans. I think it's incredibly important to highlight. We had 3x, over $900 million of applications to seek the $300 million in loans. That's how distressed our rural hospitals are today. Imagine in counties that have 64% of their population on Medi-Cal, like counties that are represented by people like Representative Valadeo, who enthusiastically supported these unprecedented healthcare cuts, the most significant healthcare cuts in American history, who enthusiastically embraced that bill and voted for it, when 64% of his own population will be devastated and impacted. That representative, whose district abuts this healthcare district alone, that received that distressed loan. Imagine the impacts to this healthcare district that is adjacent to that same representative's district, or the district by this Representative Keeley, Ridgecrest, adjacent to his district in Kern County, 54% of the population in that county on Medi-Cal. What's going to happen to Ridgecrest Regional Hospital? They're already on the ropes. They're already struggling. That same Representative Keeley enthusiastically supporting, gutting this program, cutting these funds that will disproportionately impact these hospitals that many of his constituents, again, adjacent to his district, are benefiting from. Representative McClintock, the same, up there in John Fremont Healthcare Hospital District. So this is serious. The betrayal, the big, beautiful betrayal, gutting an already vulnerable system where $300 million of distressed loans the state had to put up before this big, beautiful betrayal was promoted. And you have representatives in these very districts promoting this betrayal, supporting these devastating cuts, gutting networks of providers, the healthcare industries, which will lead to thousands, hundreds of thousands of jobs lost. About 2/3 of those, a report that was just done by UC Berkeley, about 2/3 of those 217,000 jobs they estimate will be lost specific to the healthcare sector in skilled nursing homes, board and care, hospitals, nursing homes, doctors, nurses, jobs lost, unemployment going up. Another third of those, people providing food and providing other contract and support for the healthcare delivery system. So devastating cuts, devastating impacts on hospitals, providers, healthcare coverage, uncompensated care, people struggling, suffering, premiums going up for close to 2 million people, hundreds of thousands of people that can't pay for those premiums. Now losing coverage completely under the Obamacare, under covered California, and an increase of unemployment. That's what the Trump administration's promoting, and that's what Republicans in Congress representing many of these districts have already supported. And by the way, I referenced that $28 billion impact. That doesn't include a potential additional $4.3 billion penalty because California chooses to use its own money as the federal government uses our money, over $80 billion that we provide more to the federal government than we receive for the federal government. As they cut what comes back to our state, they want to cut an additional $4.3 billion because we want to provide for mixed status families, provide for those that contribute over $8.5 billion a year in tax revenue just to the state alone, people that are out there working the fields, that are working hard every single day, not just in the fields, but many of them working in boardrooms and classrooms and working to take care of our seniors, many working in those same hospitals that they want to cut. So that is an additional $4.3 billion penalty that they're promoting. I'll remind you as well, $305 million just to gut the funding for cancer screenings, for contraception, for STI testing, to gut Planned Parenthood funding. That's in the bill. $305 million. The state puts out about $150 million. They would eliminate all of that funding. That's what these House of Representatives already adopted and what the Senate is proposing to adopt. Never in my lifetime, in our lifetimes, have we seen these kinds of cuts, the magnitude that will be profound in terms of the impacts on this state, the quality of people's lives and their livelihoods. And I haven't even gotten to slashing food assistance. I mean, where's the morality to the least of us? I'm old enough to remember what Father Cause taught me, what the Bible teaches all of us, Speaker Johnson. 735,000 Americans at risk of losing the access to food, to nutrition programs, educational assistance grants. They're looking to charge penalties up to 25% cost share in states like California. Big, beautiful betrayal. That's what's being promoted to do what? To do this, to provide tax cuts to people who aren't even asking for them and don't even need them. Disproportionately skewed to the wealthiest among us. You think I'm exaggerating? Take a look at the CBO's own analysis. $1.1 trillion of tax cuts for people making over $500,000 a year. How do you pay for that? Well, they don't even pay for it, but they get close. You gut food assistance to poor people. You gut basic medical care, preventative care to folks. $715 billion just in the Medicaid cuts. That don't even get you to $1 trillion. And you make up the rest by selling out our kids and grandkids, by financing deficit and debts to then provide even additional dollars to folks, millionaires, not just billionaires, again, that aren't asking and don't need these tax cuts while raising taxes on low-income Americans. It's a fact. Read your own bill. They increase tax on folks, I think, down to $30,000. Their taxes start going up in 2029. So that's the state of play with this bill that's being promoted. Forgive the intensity, but I never thought I'd see this in my lifetime. This is devastating. And I know that word is often, well, it's overused in this line of work. But this is, in many ways, an understatement of how reckless and cruel and damaging this is to millions and millions of people all across this country, but more than any other state here in California. And so my state of mind is resolved to continue to call this out. People need to make phone calls, call their representatives. How shameful. I don't know how these people can walk their districts. How shameful it is for these representatives, these Keeley types and Valadeo, to walk their districts and to betray their own voters like this. For Donald Trump to any way, shape, or form say it's not going to impact or hurt anyone like he did today when he lied about that today. What a shame. What a disgrace that someone could actually assert that, let alone perhaps even believe it. Someone who happens to be, in this case, the president of the United States. So we're going to continue to do what we can to activate. Grateful. We have remarkable leaders and our 2 U.S. senators and of course the congressional delegation, Democratic congressional delegation. They'll do their best, but we've got to brace for something likes of which we in our worst case scenario could have never imagined. That is arguably just a week or so away. With that, forgive the long-windedness. I'm blessed to have our Secretary, Health and Human Services, Secretary Johnson, amplify and perhaps fill in some details that I omitted.
Thank you so much, Governor, and appreciate the opportunity to do that amplification. Just to leave off, you left with the CalFresh program. This is California's Supplemental Nutrition Assistance Program. We're talking about 5.5 million low-income individuals in California, 3.3 million households accessing food they need to thrive. The proposals result in a loss of that access. Benefit levels that will not keep up with the ever-increasing cost of food will limit access to nutrition education services that support healthier food choices. As you said, these proposed cuts, these are not abstract. These are immediate threats to the well-being of millions of Californians and will impact all of us. The governor just referenced one of the major drivers of the loss of benefits is the proposed implementation of work requirements for individuals participating in both CalFresh and in Medi-Cal. This isn't about the value of work. These are proposals that are intentional sets of requirements aimed to increase the burden of those accessing healthcare and food and nutrition supports so that they no longer have this access. We believe in the value of work and community engagement, and in fact, have a successful employment and training program embedded into our CalFresh program today, which includes strategies that address the barriers individuals experiencing poverty may be facing in engaging in work. Work requirements have appeal because they align with the widely held value of work. However, in practice, they do not help people find or keep jobs. The lessons learned from other states implementing the work requirements, as the governor mentioned, in Arkansas, Medicaid work requirements had no measurable impact on employment. Half of affected individuals reported problems paying off medical debt. 56% delayed care due to the cost. 64% delayed taking necessary medications. These results are devastating, and these administrative hurdles or hassle factors ultimately undermine access to necessary care that has been shown to help low-wage workers become or remain healthy enough to work. In addition to the work requirements under the Republican proposals, many Medi-Cal participants would also have to prove their eligibility every 6 months instead of once a year beginning in 2027. As you heard, this alone could cause up to 400,000 Californians lose Medi-Cal coverage, most of whom will have still been eligible to receive it. We are in California guided by a vision of a healthy California for all, and these proposals roll back progress we've made together in achieving this vision. California's healthcare infrastructure is also at risk, and so I'd like to turn it over to Director Boss to say more about the provider impacts of these proposals.
Thank you, Secretary. We're here today really because Medi-Cal matters. It serves nearly 15 million Californians, roughly 35% of the state, including 5.5 million children and teens. It supports older adults and individuals with disabilities. Medi-Cal is more than just healthcare. It's a lifeline for the Californians it serves, providing access to vital medical and dental services, preventive care, mental health support, substance use disorder treatment, and care for chronic conditions. The proposed Medicaid changes by congressional Republicans and proposed federal rules regarding healthcare taxes would cause widespread harm by making massive reductions in federal funding and potentially cripple the healthcare safety net that all Californians depend on. These changes put tens of billions of dollars of federal funding at risk for California and could result in a loss of coverage for millions of Californians. Under this proposal, significant restrictions are placed on state funding tools and vital mechanisms, thereby destabilizing the Medicaid system. California, like 48 other states, relies on state taxes from providers and managed care organizations to bring federal matching dollars. The proposal would freeze these taxes and ban new ones, threatening this fundamental funding stream. Additionally, under this proposal, the federal government is also changing how it decides whether these state taxes are permissible and imposes more limitations and restrictions on these taxes. Several of California's major current provider taxes wouldn't qualify under the new rules, putting billions of dollars that fund the Medi-Cal program at risk. Provider taxes are essential to keeping hospitals, nursing homes, physicians, and other healthcare safety net providers stable. This cut may be fatal for the many rural and critical access hospitals that are already financially strained. This bill would also limit how much federal funding hospitals can receive through certain types of directed payments. This would mean less funding for both public and private hospitals in California. If a hospital is forced to close, every member of the community loses access to hospital care, not just the 1 in 3 Californians covered by Medi-Cal. These proposals would fundamentally undermine our capacity to serve and provide care where people need it the most, with consequences that extend far beyond Medi-Cal. These proposals will impact our emergency departments, rural hospitals, private and public hospitals, community health centers, ambulance providers, and the broader healthcare system that serves every community. Thank you.
Thanks, Michelle. So that's an overview of what we know today. Obviously, we continue to analyze all of the amendments that are being made in real time. What happened over the course of the last 48 hours as it relates to the Senate parliamentarians' assessment of what can and cannot go into the bill. Of course, there's a lot of workarounds as it relates to that. So they're being very aggressive in trying to find ways to continue to impose more harm, candidly, on communities all across this country. But the magnitude, again, of this cannot be understated. The magnitude of this simply cannot also be absorbed by backfilling through the state general fund. And while we are moment balancing our own budget, we are certainly mindful that this will have a significant impact, some of it more immediate, some of it rolling over the course of a number of years, 2027, 28, 29. But the impacts of that as we begin to address work requirements and create new system of eligibility, all of that will start to occur and have some immediate impacts. So we cannot, again, be passive in our capacity to be flexible and to address some of the intended and unintended consequences in real time. With that,
well, thank you there, Governor Newsom. I think that was an important address. Everybody let me know what you thought about that in the comments below. I think it's important to bring you that data. And I like that California Governor Gavin Newsom brought in some others to share and shed light on the real human cost of this murder bill, of this disastrous budget bill, of this massive betrayal to the American people. We will be covering every aspect of this, as always, on the MeidasTouch Network. Make sure you hit subscribe. Help us get to 6 million subscribers. And also, you could become a member of this YouTube channel. Become a member right now. We have no outside investors in this network, so that helps us grow. You can gift memberships to other people. Please do that if of course you can. And you can check us out as well on MeidasPlus.com, MeidasPlus.com. That's our Substack. That's it for now. I'm Ben Meiselas. This is a special edition of the MeidasTouch Network.
The truth is more important than ever. Check out our new Truth Over Lies collection at store.MeidasTouch.com. All 100% USA Union made.